Hello, this is Dr. Hall. We're going to advance in overweight and obesity. This is the second part of the presentation, and we focused last presentation on tips and modification of exercise. We want to go more about it, about modify the workout with the people, with the person, overweight and obesity person. We have in here 5 factors. Then we talked to the last class about the shoes, about the options of equipment like recumbent bike or elliptical, like try to use machines instead of free weights, or accommodate according with the large body size some equipment and minimize stressing, especially in lower body, then is imbalance. And let's talking here are 5 factors when you are working with a client or patient who have overweight and obesity. One is reframing exercise. The second one is sit less, move more. Be consistent is number 3, and the last one, building a habit. We're going to review each one, and we're going to start with reframing exercise. In here, it's important to use words like be active and physical activity versus exercise, which may be perceived as having negative or work labor conditionation. So it's better use be active and emphasize in physical activity as daily form of bodily hygiene, like regular daily teeth brushing or taking a shower. It must be like in that level, and assess for other chronic disease and or health conditions, and and timing of medication then require consideration physical activity testing or prescription. The other factor about working with the clients is uh, sit less and move more. This is then you make a realistic plan but challenging goals to enhance physical activity with your client, and and you must to find ways than people can have more steps walking, like grocery in the store, like parking, walking the dog. uh, don't use or taking stairs instead of the elevator. There are a lot of options. Avoid sitting for long periods like 30 to 60 minutes without interruption. It's better move. That's why you sit less and move more. And this is very important because gradually you can progress to 30 minutes or more of moderate to vigorous physical activity most of the day. The other factor in here is be consistent. This is the key to success. And in this case, science or research suggests that consistent morning exercise could help patient, and they keep higher exercise level. They simplify exercise planning, establish an exercise habit, improve exercise self-regulation, and improve also a weight loss. We have other factor than this building and habit, and in here sometimes it's you must to determine valid healthy rewards for achieving their goals. Maybe buying new shoes for hiking, or buying doing a massage for you, or new exercise clothing. um it's important in here other factor than if you do exercise in group or help your client find an exercise buddy, friend, coworker, spouse, for accountability support. Even friendly competition can be possible, but overweight and obesity often runs in families, and encourage your client or your patient to find ways to innovate their family in enjoyable movement activities and improve everyone's health, not only the person who is obesity, because with that you develop that culture of family physically active, and consider also use self-monitoring tools like smart watches, Go Fit, Fitbit, Apple Health, or Apple Watch. There are many options in the market. Now we're going to emphasize in three factors very important and working with clients or patients who have overweight and obesity. Emphasize nutrition, adjustment equipment, and choosing activities. About emphasize nutrition, mm, don't exclusively focus on the scale. Encourage patients to combine exercise with dietary restrictions to get the biggest goal, and have your clients monitor how they feel, how they spill sleep, how they function after exercise versus when they do not. More immediately feedback helps reinforce continued physical activity, and recommend working with a nutritionist or dietitian who can put together an individualized nutrition plan, or exploring commercial weight loss program. Adjustment equipment. As we talked in the last class, it is observed how much space there is not get and out of a machine or complete the movement. Note that the size of the seat sometimes can be complicated for that population. Adjustment make the exercise more comfortable for your clients, more comfortable for their size or weight, and that way also you can avoid an injury or uncomfortable or embarrassed circumstance when you don't adjust the equipment. Other is choosing activities. Choosing activities is it's important. Don't start with high impact activities. The excess weight can put extra stress on the joints, and adding high impact activities start with with a few short intervals and progress gradually. If tolerated, it's important do it high intensity activities, but do it slowly. But don't start with full weight bearing activities for patients who have more severe obese. Consider using seater, stepper, semi-recumbent bicycle, a share bicycle, and many other possibilities. And we have in here a plan, an active day plan that your client can use. We can see different times: morning, mid-morning, noon, afternoon, before dinner, after dinner. The most important here is make a realistic plan so your client throughout the day can complete at least 30 minutes of physical activity or 20 minutes of physical activity. Ideally is 30 minutes, but the plan can help, and the person can have an extra energy expenditure. Now we have some barriers, overcoming barriers with people. If you want to work with a patient, client with overweight and obesity, we have two divisions: physical barriers and psychological barriers. Large size of body, low cardiorespiratory fitness, fatigue, low energy, musculoskeletal joint pain. That's barrier, physical barriers. Psychological, fear of injury can be a possibility. Don't enjoy physical activity, low motivation, feeling self-conscious. But the most important is help your client, your patient, identify physical activities they enjoy. schedule time to be active in comfortable pleasant environment, and barriers always we're going to have, but try to deal that barriers with the strategies. We have in here the eligibility for pharmacological therapy, and this is according with the body mass index. People who has more than or above body mass index of 25, if unable to lose and maintain weight loss with only lifestyle modification, can be a candidate. More than 25 with comorbidities, for example, diabetes, hypertension, non-alcoholic fatty liver disease, can be a candidate, or anyone with body mass index above 30, 30. So that's are the criteria. Now we're going to go for the commonly prescribed medication for obesity and their interaction with exercise. We have 6 medications in here that we're going to analyze, especially the interaction with exercise. We have the first one in here, liraglutide. It increased risk of hypoglycemia when combined with exercise. We had the metformin, may blunt physiological response to exercise, consider higher doses of exercise, and exercise may counter increased hair rate for medication. Penteramine, increased energized feeling, may make patients more likely to exercise, and exercise may counter increased hair rate for medication. Naloxone or bupropion, symptoms can have diarrhea and may increase with exercise. Orlistat, fecal urgency or incontinence may increase with exercise. Phentermine and topiramide, exercise may counter increased hair rates from this medication. And paresthesia, that is abnormal sensation that may be side effect of drug, may affect exercise prescription choice. So we had these 6, and the last 2 things is when to refer to a provider, to a physician. Number 1, if a client patient with obesity is experiencing new cardiorespiratory symptoms such as chest pain, hypotension, arrhythmia, shortness of breath, especially during exercise. And the second one, if your client patient is complaining of musculoskeletal pain versus discomfort during exercise. Now we're going to analyze 2 case studies in class. One is about Jerry's, and we have Jerry's medical history in here. We're going to read it in class, and we have the current activities of current Jerry's activities. We're going to answer the questions that Jerry met criteria for class 3 obesity. We're going to answer these multiple choice questions, also this one, and also this one in here. And we're going to analyze a second case study. We have Leslie medical history, and we have Leslie current activity. In the same case, we're going to ask the question, does Leslie meet the criteria for class 3 obesity? We're going to answer these questions in your study guide, and this one in here in your study guide. Well, this is everything about overweight and obesity.